Okay, good afternoon, everyone. Nice to see y'all back. So a couple of things. Our budget memo, I sent you a copy of the budget memo and it is posted to our committee's webpage. I'm sure that would be of interest to people listening and people. Yep, the red is unmuted. Okay. I had muted it before and then, yeah, so it's all good. Thank you. But like I said, you read my mind. So one of the things I want to point out is that we had language requested for the 800,000 for recovery centers. But we had not put it actually in the chart. And so I'm like, well, that's not going to work if we have language and they don't see it in the chart. So I added it to the chart.
Thank you.
We had already talked about it, but it didn't appear anywhere. And I thought like, oh, I read the language and I said, well, I think we need to solve that problem. So you will see that in the chart that was not there when you looked at the last version. Other than that, and then the cover memo is all new. And then has done some really great work summarizing some of the issues around the high-end system of care and really us needing to put a pause on that so that we can understand really what are we committing ourselves to, particularly given the extremely high cost of the contracts that have recently been entered into for the Southern Vermont program. Anyway, so we took an unusual step and we attached that full memo to our budget memo. So you'll see all of that all in one thing posted on today's website. And for people for ease, at some time in the near future, you also see it over on the left-hand side of our webpage where there are sort of relevant documents that people like to refer to often. So you'll see it there as well. Katie is tied up on third reading in the Senate, but she will be here momentarily, but okay. So if you go to today's, you will see draft 3.1 of DR 260766. I want to tell you what I've been up to. Sometimes there's so much outside and inside, I'm just going to call it noise, if you will, that you really need to sit down and think about it all. And so what I essentially did is I have started over somewhat on this bill. And take time, Katie. I'm just kind of telling them what I've been up to. And then we'll have you walk through what we've got. So I wanted to respect the process of what we have heard, and we've received a lot of written feedback as well. We heard from the administration about their dissatisfaction with the bill. I might be misguided, but I remain committed to trying to have some cogent public policy when it comes to serving people who are homeless in the state of Vermont. And we don't have that right now. And so I started to think about trying to meld some of the concept from 594 around what were called tiers there. I'm calling them levels because I did not want any reference to what always brings up for me Act 250 and that tier thing and Act 250. And I didn't want any mistaken references to Act 250 to cloud people. And this is still a work in progress. So what you don't see here yet, because it's very complicated to put all the information together that I've received from DCF. We received information from another source about what expenditures go where. So I'm still working on that. And I'm still working on what, would be called, the limitations of service, that will come. But, so and I will be totally honest, I'm doing this on my own with Katie. What I'm trying to do is to take in the things that we've heard and the things that I think as a committee that we can try to reach some consensus on in the group and try to have a bill when we reach the end of crossover. So we're not going to be voting on any bill this week, if that's, I know it has set it on the agenda. This is going to continue to be a work in progress over the break. And I have not had any additional meetings either with the advocates and providers or with the state. What you see here is me trying to distill information and without sort of losing the concept of this continuum of services that we have been talking about. So with that, I'm going to ask Katie if she can come walk us through this draft that we've got so far. Do you have any questions about what I just shared? Yeah, go ahead, Sam.
Well, I'm just interested to know, thank you, first of all, but I'm interested to know what you would hope going forward. Do you want us to dive into this like it's the first thing we've ever seen and the whole process is going to start all over again? Or do you hope that we'll be able to kind of just tighten things up a bit? Or
yeah, I mean, you're not going to see like 100% brand new language. I mean, you're going to see things that are familiar to you.
Okay.
So no, you don't have to start over. But you'll start to see this concept of within the continuum levels of service. And you'll see sort of how we get walked through this, you'll see how they kind of build on each other. Yeah, so no, we're not starting over.
Okay.
Per se. But I felt like I couldn't go further with the draft that we had. I couldn't just keep going and fill in the rest of the missing pieces. Because I felt I needed to kind of like rewind a bit and bring us to something that I hope will resonate with people a little bit.
Okay.
Okay.
That's good. Thank you.
All right. Thank you, Katie.
Yeah, you're welcome. Katie McLean, Office of Legislative Counsel. Here we go. So this is draft 3.1. And changes since the last time you have seen them are highlighted in yellow. So some of these changes reflect some of the committee markup from last week. Yeah. So one of the big changes is the title. It had been Vermont Homeless Response Continuum. So Vermont Homelessness Continuum, you'll see that throughout. And then we move to our findings section. The General Assembly finds that although an imperfect tool for measuring the true number of unhoused Vermonters, the Vermont Homeless Management Information System as of December 2025 indicated that there are 4,022 individuals who are homeless in the state, 863 of whom were children under 18 years of age. Subdivision 2, the General Assembly finds that in the 2024 Vermont Housing Needs Assessment notes that of the 36,000 primary homes needed in Vermont between 2025 and 2029, the number needed to address homelessness is 3,295. Then on page 2, we move to legislative intent. It is the intent of the General Assembly that unsheltered homelessness be eliminated and that homelessness in Vermont be rare, brief, and non-reoccurring. That Vermont reduce reliance on the inefficient use of hotel and motel rooms for emergency housing. That utilization of an emergency housing benefit to access hotels and motels through the General Assistance Program end and be replaced by a continuum of care. And a continuum of supports and services be available to provide a stable pathway to permanent housing that meets the specific needs of households experiencing homelessness. It is the purpose of the Act to establish a continuum of supports and services for households who are experiencing homelessness or who are at risk of experiencing homelessness. To ensure that tailored temporary emergency housing assistance is available to Vermonters in a manner that encourages efficient and accountable use of taxpayer funds. Page 3, that support self-sufficiency and reduce returns to homelessness by developing personalized housing plans with required participation by households. That establish clear eligibility criteria and require active household participation. That expand the use of alternative emergency housing models in partnership with municipalities, nonprofit community-based providers, and private landlords. That integrate supportive services to assist households to achieve permanent housing stability. That establish transparent accountability measures, reporting requirements, and oversight mechanisms. That increase program efficiency and promote maximum flexibility in administering services and supports in the continuum. That empower local communities to administer emergency housing services with maximum flexibility. And that create a diversified system of emergency housing options, including shelters, specialized services, shared housing arrangements, host home models, master lease units, and rapid rehousing placements that provide cost-effective, sustainable, and supportive outcomes to households.
So, I'll just pause there just for a minute, Katie. So some of the changes that you see here is a reflection of looking at the work that the committee had previously done, and then also looking back at some of the language in 594 that seemed important to the administration. Where you see not all of the changes in yellow, but some of those changes in yellow are to reflect sort of a marriage of the two. Thank you.
Madam Chair,
Yes.
can we just reflect on page 2, line 7, utilization of emergency housing benefit to access hotels and motels through the GA program. I think we understand what that means around the table, but I think our discussions end by the administration. The hotels and motels will continue to be used in some form, sort of shelter-like. And I wonder if some clarifying language of access to hotels and motels on a per night basis through the program. Just if someone looks at it, I'm just envisioning a year out from now, 2 years out from now, someone's like, there's still all sorts of folks living in the motels. I thought we were doing away with the motels.
Well, that's why it says through the general assistance program.
Yeah.
It seems to be, I guess I'm going to say, and maybe this is just because I've been living this for so many years now, but that people refer to it as the GA emergency housing. So that, from my perspective, I think that
That's covered.
covered.
Okay.
Thank you. Okay, let's move to the next section.
Page 4, section 4. This is the creation of the new chapter and statute in Title 33, the Human Services title. And the first section is definitions. Maybe I'll just go over them if they've changed since the last time you've seen them. So we have alternative housing options, means housing options including shelters, specialized shelters, transitional housing, recovery residences, shared housing arrangements, host home models, master lease units, and rapid rehousing placements. And 2, applicant means a household that applies for emergency housing assistance. I'll skip over 3. 4, case management services means individualized supportive services. Subdivision 5, coordinated entry means a process that standardizes the way households at risk of homelessness or experiencing homelessness access and are assessed for and referred to the housing and services that a household needs for housing stability. I should flag here, I'm not sure that I think we should check. I've already said this at the end of this process to see that all of the defined words are used in the text of the chapter. I'll skip over department. I'll skip over the definition of disability. Those are unchanged. Diversion means a strategy aimed at preventing homelessness by helping households find immediate alternative housing options instead of entering shelters. Diversion focuses on addressing the needs of those who have recently lost their housing. Eligible household means a household that is homeless and is physically present and intends to reside in Vermont, as evidenced by active participation in a housing, employment, or other AHS recognized plan. Let's skip over emergency cold weather shelter. Oh, no, that does have a change. Publicly funded shelter beds made available to households during periods when the National Weather Service is forecasting temperatures at or below 10 degrees Fahrenheit, including wind chill for the majority of the state. Subdivision 11, emergency housing means temporary shelter, lodging, or other housing support or related services provided to eligible households to protect the health, safety, and welfare of an eligible household when no safe housing option is immediately available. Homelessness means lacking a fixed, regular, adequate nighttime residence, facing imminent loss of primary nighttime residence, fleeing or attempting to flee domestic violence, residing in a place not meant for human habitation, such as cars, parks, abandoned buildings, or streets, or otherwise defined as homeless under federal law. The definition of household, the last clause was removed. Minor child is unchanged, office is unchanged. Permanent supportive housing means long-term housing with wraparound services for individuals with complex health and social needs. Prevention means services intended to prevent a household from becoming homeless, including housing relocation or stabilization services or short-term rental assistance, including rental arrearage. Program is the Vermont Homelessness Response Continuum. Rapid rehousing means short to medium-term rental assistance and supportive services aimed at assisting a household to quickly exit homelessness. Shelter means a facility that meets the department's shelter standards. And the second clause has been removed. Specialized shelter means a facility that meets the department's shelter standards and applicable standards for the delivery of additional services, including healthcare, mental health services, services related to substance use disorder. And we have a definition of supportive services. And there is the addition of services to ensure continuity after permanent placement. Also swapping out such as with including on line 3, and I think on line 4, switching out on for of. And then subdivision 23, unsheltered homelessness means sleeping in a location not designated for or ordinarily used as a regular sleeping accommodation, including cars, parks, abandoned buildings, or streets. And 2202, we move to the description of the continuum. So the Vermont Homelessness Response Continuum is established to create an array of services that prevent and address homelessness in Vermont. The program shall be administered by the Department's Office of Economic Opportunity. The office shall maintain a continuum of care that is flexible, housing-focused, and designed to prevent homelessness whenever possible. The continuum shall prioritize early intervention, rapid resolution of housing crises, and equitable access to emergency and permanent housing. And C, the program shall provide temporary emergency housing to eligible individuals and eligible households experiencing homelessness.
We should get rid of eligible individuals. Just trying to be consistent because the definition of households includes individual.
Thank you. So just strike eligible?
Yeah. No, eligible individuals.
Oh, you're right. Yep. Provide temporary emergency housing to eligible households experiencing homelessness or at risk of homelessness. Reduce reliance on hotels and motels for emergency housing assistance. Expand use of alternative housing options in partnership with community organizations, municipalities, and private landlords. Integrate case management and individualized housing plans into all emergency housing placements, and ensure accountability, transparency, and cost efficiency in the use of public funds. And then 2203 sets up the components of the continuum of care. So level 1 is prevention and diversion services. Level 2 is shelter services, broken out by highly structured shelter services and low barrier shelter services.
just a note there, and it might not be the right term, but, high barrier didn't make sense to me. So I tried to come up with something that was more reflective of what happens. So if somebody else can come up with a different term, that's fine too, but, high barrier to me would mean that it's hard to get into. Right.
Yeah.
Level 3, specialized shelter services. Level 4, permanent supportive housing services. Level 5, hotels and motels, broken out into hotels and motels with supportive services. And winter and non-winter hotels and motels. I think I need an S there. And then 6 is other emergency housing services. Hotels.
So, let's pause here for just a minute. So, how this is, flipped essentially, in previous versions, of course, we didn't see these level things, but in previous versions, we saw prevention and diversion. And then we saw hotels and motels, and then we saw shelter, and then, the, specialized shelter, and then permanent supportive housing. And this is set up to show that, as you will see in the next piece, that you only use the hotels and motels if you don't have access to any of those things that come before that.
Ask a question.
Of course.
Prompted by looking at the reference to the hotels and motels. And earlier, I was asking a question about reference to hotels and motels and how it's coming to an end for the GA emergency housing. Are there smaller components of GA emergency housing outside of what we think about with respect to the homeless? I have a recollection back from past career working at the Red Cross. Someone who's had homeless destroyed in a fire may be put up through emergency housing, thought through GA for a few days or something like that. Are we unintentionally making a change or impacting the non-homelessness use of GA?
Oh, that's homeless. If somebody's buying a house was burned down, it's homeless.
Yeah. Yeah,
Not that I think, but as we work through this, keep that in mind.
okay.
Okay, I'm gonna skip over subsection B, and that brings us to 2204, prevention and diversion services. So now we have a header at the top of each section reminding us what level we're in. Prevention and diversion services shall function as the primary entry point to the Vermont homelessness response continuum for all households. The department shall ensure that prevention and diversion services are provided through an agreement with one or more community partners in each region of the state in a manner that accommodates an eligible household's disability, if any. All households, upon request for assistance, shall receive a standardized prevention and diversion assessment to identify safe alternatives to homelessness and resolve immediate housing barriers. And then the next two sentences are broken out into subdivisions. Prevention includes activities to avert entry into homelessness. Diversion includes problem-solving interventions that supports that safely resolve a housing crisis without the use of shelter and hotel placements. Top of page 11, funds administered for prevention diversion services shall have maximum flexibility.
So a concept that I have been thinking about, but haven't really figured out whether it should be kind of like a whole, just one overarching section that applies to everything, or whether we should be thinking about it in each section. But so, when this says that they would, these services are provided through an agreement with one or more community partners. So trying also to use existing structures as much as possible when they make sense. So we have existing local housing coalitions that are located, throughout the state. They cover the whole state. I guess that's something that I'm interested in feedback about from the committee. So we can be generic and say one or more community partners, or we can say through agreements with each local housing coalition. I don't need like a reaction right now, but, it would be a more specific direction being given to the department. And those coalitions include, a variety of different people. I mean, nobody's excluded from being in a coalition. But it gives, more direction, and that it's at that regional level.
There's also community kind of decision-making process to it, rather than one organization kind of getting the funds and being like this person kind of thing, one or more.
Right.
I think it forces that.
So, any concern that in different parts of the state, the strength of the coalitions may vary? I'm not familiar enough with them to know whether services would be consistently available through the coalitions. Maybe not an issue.
Well, I think that what we'd be saying is that these coalitions, if they're going to have the responsibility for the funds, would need to assure that these services are provided in their region. Now, it doesn't mean every member of the coalition has to provide every service. It just means that, what we're saying is that the state would contract with you to provide this type of service in your region. And I don't know as much about like whether we'd say a lead organization within it, or I kind of prefer to kind of keep it a little more broad and say the, local housing coalitions, because then that gives them the opportunity to, I think, have discussions among themselves for the local decision making about the state's not going to give it to like, if there's 10 different organizations in a local housing coalition, they're not going to, I would not want them to divvy it all up among 10 organizations. The concept is that as a region, you decide how we best going to manage this.
Are those housing coalitions set up in a way that they can receive funds? I don't know the level of formality in which they operate. Are they?
Well, that's what I mean by they would be talking among themselves about how is it best to administer these funds to our region. So it could be one type of provider in one region and a different type of provider in another, that sort of takes on the responsibility for managing the funds. But that's a decision they can make locally. That's the part that I like about it, because there's local decision making that happens, and they agree as a group about what would happen in discussion with the department office. So, yeah, go ahead.
It strikes me along the same point that 5 years out, this stuff will probably all sort of sort itself out. It'll sort of kind of get organized. And so I just wondered if, I don't know, perhaps down in the further on, there's some description about how we're kind of overseeing that, or is there a board of folks that are seeing this? Are we expecting OEO to manage those various processes? Is it just through the granting process?
It'll be through the grant process. So the allowed uses and the outcomes expected and those kinds of things, that would be in the grant process.
And that feels sturdy enough for you to feel like it would work?
It's what we do in state government. Yeah.
Okay.
Jubilee.
Yeah, so same issue I had kind of in the last draft. And I see there's been some changes to the prevention and diversion services. Just this bullet 2, specifically without the use of shelter or hotel placements. And I am concerned because the kind of current pot of money that does this work allows it to be used on folks who are in shelter or motels so that they can quickly divert out of being in a shelter or a motel through the purchase, like paying the security deposit on their half, or maybe a utility deposit or first month's rent. And so this language makes, I have a fear that they won't be able to use those funds similarly anymore, which are really crucial for people, even if they're in a shelter or a hotel, to get rapidly exit out of homelessness. So I just am concerned by including that parameter in there, that they can't act without, if they're not in a shelter or hotel placement.
Well, I mean, isn't that the whole concept of prevention though?
Well, diversion though, that's why I kept bringing up these definitions of prevention, diversion. Diversion can be kind of diversion. It doesn't necessarily mean that they don't enter shelter. It just means that they quickly resolve their homelessness. And so I'm just afraid by this language that they won't have access to those really important funds that do allow them to divert rapidly from homelessness.
So the fund, I guess what I'm laying out here is that I wouldn't want these funds to be actually used for hotel or shelter placements. It doesn't mean that they couldn't utilize funds to assist somebody who is in a hotel
Mhm.
to access, and so that might not be clear. So
Yeah.
what you're talking about, which is a current use, would
Mhm.
continue to be allowable.
Okay,
Um,
just to me,
I
it reads,
understand
and
what
I
you're
know
saying.
Lily
Yeah.
had the same feedback when she read it,
Yeah.
that this is like precluding folks who are in shelter or hotel
Yeah.
from accessing these funds when these are the funds that allow us to get them out.
Quickly.
Yeah.
Just adding a clause at the end, it's without the use of shelter or hotel placements, comma, or to access them the same expeditiously, or, you know, whatever.
Yeah, well, I think what, I think we can, we want to be able to continue to use those funds how we're using them now. We just don't want them to be used for hotel and shelter placements because those are covered in another part of the bill. And I wouldn't want things that are really intended for prevention and diversion to get sucked up by use of, hotels. So,
But they can work in concert together.
they can, yes, I need to print me out a copy of this. But will you print me out a copy, Lori, and then I'll grab it, the bill?
Yes.
Thank you,
I have to go fill my water bottle, so if you want me to. grab it,
Okay.
it's on my way.
thank you. Does anybody else want a hard copy of this while we're doing this? One, good, so a couple. Okay, yes, I'll be all of them, Lori, thank you. Okay. Okay, thank you, so let's keep going.
So that brings us to section 2205, shelter services, and this is broken into two pieces. First is the highly structured shelter services. The department shall determine the need for highly structured shelter services and to the extent funds permit, develop sufficient highly structured shelter services to address that need. The department shall enter into agreements with community partners for the provision of highly structured shelter services for a period of not less than 2 years at a time. Highly structured shelters shall provide programming that emphasizes case management, housing stability, employment, education, or treatment services, as well as other services as appropriate, in a manner that accommodates an eligible household's disability, if any. Eligible households receiving highly structured shelter services shall participate in case management and other services to the extent of the eligible household's ability. Then we have a reference to the Fire and Building Safety Code. And lastly, if an eligible household's needs cannot be met with the level 1 prevention and diversion services in section 2204 of this chapter, highly structured shelter services is the preferred initial placement if capacity, staffing, and geographic accessibility are available. Then subsection B is the low barrier shelter services. The department shall determine the need for low barrier shelter services and, to the extent funds permit, develop sufficient low barrier shelters to address that need. The department shall enter into agreements with community partners for the provision of low barrier shelters for a period of not less than 2 years at a time. Low barrier shelters shall minimize barriers to entry by reducing the rules and programmatic requirements found in highly structured shelters, while still providing case management and other housing support services in a manner that accommodates an eligible household's disability, if any. Stays in low barrier shelters shall be time limited, and eligible households shall be transitioned to highly structured shelter services or permanent housing as soon as feasible. Same language about the Fire and Building Safety Code. And in 4, subdivision 4, if an eligible household's needs cannot be met with the prevention and diversion services in level 1 or the highly structured shelter services in subsection A of this section, low barrier shelter services may be utilized if capacity, staffing, and geographic accessibility are available.
So, let's just pause here for a second. So, this is, this is, using some of the concepts that were laid out in 594. And, really looking at, preferences for what services are received first, and assessing needs and what's the preferred, access, first. That's why you see a different order here essentially than what you saw before. And I guess that's it. That's all I need to say. And, somebody remind me what that section was just before this, that we were just talking about the diversion and prevention and diversion.
Yeah, the last line on page 10.
Yeah, got it. Thank you. Okay, thank you, Katie.
Okay, that brings us to section 2206, specialized shelter services, level 3. The department shall determine the need for, and to the extent funds permit, develop specialized shelter services that comply with the Fire and Building Safety Code, as well as any other applicable standards relevant to the specialty population. To the extent funds are appropriated for this purpose, the department shall enter into agreements with community partners for the provision of specialized shelter services for a period of not less than 2 years. Sorry,
I keep going till the end of the section, then I'll talk about the section.
Okay.
Sorry.
No, that's okay. A specialized service shelter shall provide services delivered in a highly structured shelter, as well as additional specialty services such as services for substance use disorder and mental and physical health conditions. Eligible households receiving specialized shelter services shall participate in case management and other services to the extent that the eligible households of the eligible household facility. If an eligible household's needs cannot be met with level 1 prevention and diversion services in section 2204, or the level 2 shelter services in 2205, a specialized service shelter may be utilized if capacity, staffing, and geographic accessibility are available and the eligible household requires specialized services.
So, sorry for interrupting before. It refers to the department, and in this case, it means the Department for Children and Families. And we've heard in testimony that these specialized shelters are more likely to be developed by other departments within AHS. So for instance, the shelter for people with healthcare issues is something that I know that Dale is working on. And I think BDH is going to be the entity that works on a shelter for people with substance use disorders. And so I feel like we need to somehow modify the language where it references the department.
Maybe the departments of the agency shall determine the need for, and to the extent funds exist, develop. Or it could just have the agency as the entity.
Well, I think that the department can still determine the needs for the needs for the shelter. I think it was more to on line 9. So it's not going to be DCF that enters into agreements with community partners. So maybe we could just say the relevant AHS department or something like that.
In line 9.
In line 9.
Up on the line 5 and 6, where it says the department, it also determine the need, but also it says on line 6, develop specialized shelter services, where at that point, they may identify, but they're probably handing off to a.
Probably handing off the development to a sister department, yeah.
Just put a period after permit and start a new sentence. We can use that same phrase, the relevant AHS department shall develop.
Shall develop, yeah, that sounds good.
Okay. The next section is 2207, permanent supportive housing, level 4. The Agency of Human Services or any department within the agency shall provide or enter an agreement for permanent supportive housing that combines long-term community-based rental assistance with voluntary flexible supportive services such as family supportive housing and other supportive housing services funded in whole or part by Medicaid. Eligible households receiving permanent supportive housing services shall participate in case management, planning for housing stability, and other services to the extent of the eligible household's ability. If an eligible household's needs cannot be met with the level 1 prevention and diversion services in section 2204, the level 2 shelter services in section 2205, the level 3 specialized shelter services in 2206 of this chapter, permanent supportive housing may be utilized where capacity, staffing, and geographic accessibility are available.
The one thing I wanted to point out here, because there were, I think Lily had brought up the question, and I think Ray, you had brought up the question. So this is intended to include family supportive housing, so that phrase is added on line 8, but it's not the only thing. I mean,
Right,
there's other
supportive.
supportive housing, and we reference that they may be funded in whole or part by Medicaid. And yeah, okay. So this is the other thing, on lines 5 and 6. It's any department within the agency. So, previous versions of this really were just speaking about, DCF. And, we know in this committee that the Agency of Human Services through other departments like Dale, like DMH, like DOC even, they provide supportive housing to folks in a variety of different ways. So I felt like it needed to be broader than just DCF. So I just wanted to call your attention to that change.
2208 is hotels and motels.
Sorry, the last sentence, if we look at 2206 at the top of page 14, accessibility are available and the eligible households require specialized services. Do we need the same on line 18 to finish that sentence with, and for consistency, and eligible households requires permanent supportive housing, or is it not?
Sure.
So
Do you have the extra one that?
you're talking about the phrase and requires the special. So I only did that for level 3 because
Oh,
they are special
Thank you.
services for individuals with a mental health condition or substance use disorder. So flagging that prerequisite for going into those type of shelters would be a need for those type of shelters versus the general
Right,
population.
that's determined before you actually even get to, yeah.
Needs to be added to the stuff.
Okay. 2208, hotels and motels. This is level 5. It is the intent of the General Assembly to decrease reliance on hotel and motel rooms. However, until sufficient permanent affordable housing or shelter services are available, the use of hotel and motel services shall be permitted. Let me break into the 2 categories. First, level 5A is hotels and motels with supportive services. Annually, as part of the department's budget presentation, the department shall set goals for increased housing capacity, including permanent supportive housing, permanent affordable housing, and shelter beds. The department shall provide data pertaining to the increased shelter capacity and the extent to which shelter capacity meets the needs of eligible households experiencing homelessness each year. The department shall propose hotel and motel rates as part of its budget presentation for the General Assembly's consideration.
So I'm just thinking, Katie, I'm just thinking that, not the last sentence of paragraph A, but the rest of paragraph A is really something that doesn't necessarily go under hotels and motels. It's something that's I think it goes more at the beginning of this part of the chapter.
Okay.
Or maybe under a section that we'll have, which is, department
Evaluation.
responsibilities or something.
Reports, yeah.
Okay.
But I think it needs to move from here.
Okay.
Without a cap, how are you gonna know if people are over abusing the hotels?
It does not appear here yet, but I am gonna be suggesting caps.
Thank you, because I can see it being abused. Thanks.
You might not like the ones I suggest, I'm just, well, you know, I have no idea, that was sort of a joke, so.
I'm okay. I was thinking, okay.
I didn't want you to get too excited, Brenda, that's all.
Okay, thanks.
Okay,
So retaining this sentence, the department proposed hotel and motel rates as part of it,
but that's references to hotels.
hotels.
Yeah,
And then in E, eligible households placed in a hotel or motel pursuant to this program shall participate in case management services, planning for housing stability, and other services to the extent of the eligible household's ability. If an eligible household is placed in a hotel or motel pursuant to subdivision 1, the department shall enter into an agreement with one or more community partners to provide relevant supportive housing, permit population-specific placement to the extent certain populations are not isolated from the wider community served by the program, and use only hotel and motel rates established by the General Assembly. If an eligible household is placed in a hotel or motel pursuant to the subdivision 1, the community partner shall enter into agreements for use of blocks of hotels and motel rooms and negotiate conditions of use for those blocks, including access to providers of case management and other supportive services. And then we have an E, the rules that have to be complied with by a hotel or motel used under this chapter, and that's with the licensed lodging establishment rule and the Vermont Fire and Building Safety Code. In subdivision F, if a household's needs cannot be met with the level, I won't go through them all, but 1 through 4, the department may utilize hotels and motels if capacity, staffing, and geographic accessibility are available. I wonder if there's shorthand for that.
I
think I do that in B, where I finally gave up and just did yep, right there. I gave up and just did a range. Maybe I'll put that there.
so the, this is, wait a minute. Okay, it says it at the heading. I just want to make sure that people are clear that this level is the use of hotels and motels with supportive services.
Maybe
We're
that,
not calling them to be run as shelters because we run into zoning issues.
I wonder if that could be made fair in the language.
Yeah, that's what I was wondering. I felt like by the time we got to the end, I wasn't sure that was clear.
Yeah, the department shall propose hotel and motel rates. It feels like there needs to be something sort of summarizing what is happening in 5A before we jump into the rates.
Maybe if
B.
we define hotels and motels with supportive services.
No.
So maybe we start it with hotels and motels with supportive services are defined as, and then we say, you know, rooms or blocks of room, and then we kind of say what we talk about that have to be entered into in the agreement, but then we reference supportive services as defined and reference back to the definition to make it clearer that those supportive services, that's what we're talking about here.
Okay, I don't know that we have to reference back if it's in the same chapter. I'm sort of wondering with leading with this language in B, hold on. Eligible households placed in hotel or motel pursuant to this program shall participate and shall be supported, no, shall receive supportive services and participate in case management, something like that.
Something like that.
Okay.
Go ahead, Esme.
I'm keeping struck by the need to be met piece, just because, just.
By the way, I'm sorry, I coughed when you
Oh,
said
that's
something.
okay.
Sorry.
The needs cannot be met language, because, yeah, like, in terms of our legislative intent, what does that look like? Like, the needs cannot be met, or is there a precedent, like, in terms of saying that someone's needs cannot be met through a particular policy? Or,
Well, I'm sure there's precedent someplace. but I'm not-
Okay.
I'm not gonna be able to tell you where that is, but,
yeah, so,
the concept
yeah,
is, starting out with the lowest cost, lowest intervention.
yeah,
And moving through, and I'm not gonna say it, because it doesn't all follow that, because actual placement in a hotel is
Mhm.
lower cost than placement in a shelter. But, that, we prefer the services of a shelter over the non-services in a hotel. So it's not all based on cost, but,
Mhm.
it is, essentially trying to identify the preference in policy for what services get used first. Now, I need to be real.
Mhm.
We know that, at least the last I knew, 100% of our shelter beds were all full,
Mhm.
or very close to that. So that's why it says to the extent that they're available. So, you might move through this relatively quickly without actually going anywhere. Do you know what I'm saying?
Sure. I guess part of my question is like, is needs strict, like shelter, or is needs like service connection, or is it both?
It's both, It's like, can that
So that's what we're
first
defining
be
needs.
accommodated,
Yes.
both by what the shelter provides
Yeah.
and what the person needs.
Yeah.
And so there might not be a match, for
Yeah,
instance. So there might be an opening at, let's just use this, there's a specialized shelter for, women with substance use disorder in
Mhm.
Central Vermont. So let's just say, okay, so you have a woman, but and she has children,
Mhm.
and there might be an opening there, but she doesn't have substance use disorder.
yeah,
So it wouldn't make sense to use, to require the use of that bed,
yeah,
because the next person that comes along may in fact need that and need that specialized service.
yeah, totally,
So that's how I see it.
yeah.
Does that help at all, or?
It does, for the like categorizing of where people are placed. It is helpful. Because the needs, I guess. Yeah, just wanting to make sure that it's hard, because the needs perspective could come from either the person
Yeah.
themselves or the department placing them
Yeah,
in a certain place, like, here's what I think your needs are versus here's what, I think your needs are,
Yeah.
the person receiving those needs. So, I just wanted to make sure that the language was, precise enough for us to convey what you just described. And I didn't know if there was like history there, or if this is sufficient. Maybe it is. It just kept calling my attention, in terms of how it could be interpreted. But right now I don't have a suggestion, and it helps to hear the context of where you came from with that.
Well, and I think that, I think we need to talk about, I'm not necessarily envisioning the department making those decisions.
Okay.
That's why when I was talking about the local housing coalitions, I know that they sort of have systems discussions, but they also have sort of case discussions.
Yep.
And, you would hope that there would be, I hate this term because it's ridiculous, but the no wrong door,
Yeah.
so if I went to, the day station in Burlington, that they would be talking, and that person is presenting with whatever needs that they have, and
Yeah.
they're thinking about this continuum of services and thinking about, their local housing coalition and needing to be able to connect with the right people there, that a person could be assessed relatively quickly and receive shelter relatively quickly in whatever level that might be appropriate and if it's available
Yeah.
in that geographic region. I think that's another one of the things is that trying to avoid people being moved all over the state, you know, and trying to avoid the things like Representative McGuire has talked about, you know, sort of, you know, feeling like some communities have received a sort of overplacement of people. And of course, people would prefer to stay connected in their local communities if at all possible. So that's kind of how I envision that.
Yeah, that's really helpful. Thank you.
You have something, Eric?
No, just thinking and
Okay,
processing.
I wasn't sure. Okay.
Okay, 5B is winter, non-winter hotel and motels. To the extent funds exist for this purpose, a household shall be placed in general access hotels and motels if no available options exist within levels 1 through 5A of the continuum of care. But
Should we change that last word care to maybe continuation of, or continuum of services, or?
Whatever we call it.
There was, I don't know if there's a consistency thing going or not. I know that there was mention that the word continuum care is sort of a branded
within the
thing.
Yeah, I would say continuum. I think you just.
Continuum.
If an eligible household is placed in a hotel or motel pursuant to the subdivision 2, the department shall enter into an agreement with one or more community partners to provide relevant supportive services, permit a population-specific placement to the extent certain populations are not, to the extent certain populations are not isolated from the wider community served by the population. And
Program.
thank you.
It says program.
You knew what I meant.
Yeah, great.
And Roman numeral 3, use only hotel and motel rates established by the General Assembly. Subdivision C, if an eligible household is placed in a hotel or motel pursuant to this subdivision 2, the community partners shall enter into agreements for the use of blocks, hotels, and motel rooms and negotiate conditions of use for those blocks, including access to providers of case management and other supportive services.
So before we get to D, so the concept here is that it's still not, I guess I would call willy-nilly use of hotels. It's still a plan, something that's planned in advance, essentially, and still has an expectation that I'm saying this out loud, that people are, that there's still an expectation that people participate in planning for housing stability. So it's not intended to be just a roof over somebody's head. But I'm having you know, as we're talking about, and I know Katie had emailed me about this, I'm in my head now, I'm having a little bit, and as I'm reading through this again, having a little bit of trouble discerning this section from actually the previous section. And so I think we gotta think about that.
One structural thing as I'm, hearing it out loud, is on page 17, B and C are duplicative of what is in level 5A.
That's what got me thinking about it.
Yeah.
Yeah.
And it sort of makes me wonder, maybe those could be moved up under the 2208, like the main language before we break it out into categories. So that language is applicable to both.
Both, yeah.
And then you would just have your sort of programmatic specific instructions under A and B.
Is it that you're trying to distinguish between hotels and motels being used as a tool to address the housing issue essentially, as opposed to what I see coming in section D, which is more emergency related. And it's that kind of line you're drawing there.
Yeah, the answer is yes to that. I mean, I think that we're trying to limit the use of hotels and motels that do not come with supportive services.
And that happens at D essentially.
Yes, and that's, so I'm feeling like I'm maybe overcomplicated it a little bit.
It strikes, as I read it here, it strikes me that B and C are essentially the same thing.
Yeah.
That's what I'm reaching that conclusion as we are working through this.
Get rid of
So-
blend them, or if there's any
Well,
blending
yeah,
involved.
I think that is, if I'm not the only one who was feeling that as it was kind of as you're reading it out loud, that's what was striking me and, so, it seems like other people are having that same sense. So I'm thinking, Katie, we might think about how we work that, is there, and maybe I'm gonna ask you a question. I'll try that approach. Is there anything different in 5A from 5B before we get to winter weather?
The sort of emphasis on that we, especially the change we just made to receive supportive services. And what is now labeled 5A subdivision B. We now have eligible households placed in a hotel or motel pursuant to this shall receive supportive services and participate in case management. What I'm sort of thinking about as I'm sitting here is taking what is right now on page 15, C, D, and E, and those would apply to all hotels and motels, I think, and moving that language up above 1. So it would just fall under the heading 2208. So everything that would apply to both categories would apply up in that section, and then any program-specific language you have would appear in level 5A and level 5B. So if you wanted to have, like, retain this language in 5A, that you have to meet these, if you can't be served 1 through 4, then we come to 5A, then that would be under the 5A section. Was that clear?
I
There's
think I
much.
get it. So is okay. Right now, as I'm looking at these side by side, the only thing that is different is on page 15, paragraph B. And the thing that says department should enter with one to provide supportive services.
Well,
So we actually say that in the next section too. So that's what started to get me thinking. Because we're saying the department enters into agreement to provide supportive services, but then there's nothing that says that the people are going to receive supportive services in 5B.
Yeah.
Um,
Although you just added that. Eligible households placed in a hotel and motel pursuant to this program. Oh, and 5B, sorry. I'm looking at 5A, B,
Yeah.
under 5A.
yeah. I think that what we want to promote is that if hotel and moteler is going to be used, that it comes with supportive services, period. So I'm thinking that we're going to eliminate the redundancy until we get to D.
Till we get, yeah.
Don?
So I'm thinking of an instance, maybe I'm not thinking correctly, but I'm thinking of an instance down the road. It seems like with the dollars available, this might not be able to happen now, but there might be a 5B use for hotels and motels that have no services involved that are not emergency either. Would there ever be a space where there would be people?
I honestly think that's what we're trying to eliminate.
Yeah.
Okay. All right.
mean,
So in other words, eliminate.
it's one of the problems that we're trying to solve.
And that is hotels and motels are not housing in the sense of housing without services, private housing.
Right.
And this would leave that possibility, yeah. I think that the likelihood of that existing is still available, but we're trying to intend it not to be that way, so it's smarter not to put the language in.
Yeah, I mean, I think that, you know, when I think about the big picture, we are actually trying to eliminate their use without supportive services, because we don't want people to stay there.
Right, exactly.
So one thing I'm struggling with,
Yeah,
but I'm conflicted because of limited resources, is that we know supportive services are not inexpensive, right? Like it takes resources to provide that service.
Yeah.
So I'm just kind of trying to grapple in my head of we will reach a point where we may have more capacity of hotels and motels, but will not have capacity for the supportive service.
That's where I'm going, that's where I'm.
A little bit, particularly when it's like the winter.
The transition period.
Right.
Well, the winter would.
But outside of the winter months, then it's a policy decision, right? Like
the winter months is about true safety from my perspective.
Right,
Urgency,
so,
yeah.
and again, like it is a personal conflict for me.
Yeah,
Because I know, the balance of resources versus.
Right, better service, fewer people.
Right,
so I think that's something, you know, we all need to kind of like sit
Sit
with
with,
and,
yeah.
and kind of like think about, but for the next version, Katie, let's think about this as hotels with supportive services, and then we'll move into cold weather.
I might be missing it, but did we take out accountability from H 594 to help people get on their feet and require them to get help and recovery and help them with jobs? I can't find that.
Yeah, it's in there.
Okay, so it's coming, it's coming?
It's right in the beginning.
It's right in the beginning, it's
And it's
also in a big,
required,
it's a big,
required,
it's right in
or
the
they lose
beginning.
their housing? Okay, as long as it's there, because otherwise you'll never get people to do it.
It says in every section, the participants shall participate in case management, planning for housing stability, and other services.
Maybe we
Including
can be more
employment.
specific though, like recovery, job searches. Maybe it should be more
It does say that
specific.
here someplace. 'cause
It
I
does,
remember
okay.
reading it, yeah.
I missed it.
It could be in a definition someplace.
And when you list it out.
Oh, supportive services, yes, when
It's
I,
in there.
it's in the
And then
definition.
sometimes what happens when you list things out, then it's like only those things, and then you kind of.
Find something else.
Yeah, so you limit
So
yourself.
are they given like a time period if they don't participate and they miss more than one?
There's a section that's, that's yet to be worked out, that has a heading, we haven't quite come to it yet.
Okay, I just want to help people
Yes.
get out of, help them.
There's a specific section identified there
Just
for any
sticking them in a
needed
room.
details.
Okay, thanks.
So Brenda, on page 7,
Okay,
starting on line 10, if you read through that whole definition, it goes up onto page 8. So every time we say supportive services
that's what that is.
that people are required to participate in, it's all of those things, okay?
Okay. Yeah, because otherwise poor people will never get out of it. Thanks.
You're welcome. Okay, Katie?
So can I just recap on the structure for
Yeah.
this level 5?
Yeah.
So now the title heading will be hotels and motels with supportive services. That's what 2208 will be. You do want that divided into 2 sections? You want an A and then a B that's specific for cold weather?
Yes,
Then what would the A be?
hotels and motels with supportive services.
I thought that was the whole section heading.
Level 5A,
Oh, that's still hotels and motels.
hotels
Okay.
with supportive services.
So it's sort of same construct as now. Okay, got it.
Yeah, there's a thing that applies under level 5
Mhm.
that applies to all hotels, like they have to meet the building codes and all of that. That should be at the beginning. And then under the 5A, it would be talking about the participation in case management and supportive services
Mhm.
and all of that. Okay. Okay, so now let's look at, I think we got up to winter weather.
Annually between December 1st and March 31st, households may be placed in general access hotels and motels. Use of hotels and motels during these months shall only occur if no available option exists within levels 1 through 5A of the continuum. I'll get rid of care. Services provided pursuant to the subdivision 2 shall not occur on a night-by-night basis.
I asked, just what, I don't know quite what that means then. Shall not occur on a night-by-night basis.
I would read that to mean that it wouldn't be every night there's a
A
decision happening, but
Mhm.
more of a plan put in
Okay.
place.
All right.
I don't know if something different was intended.
So the, department indicated in their proposal that they wanted to revert back to, what they called off adverse weather conditions, which meant that each day they would decide whether there would be hotels available or not, and whether they were sufficient for the people asking. And I just say that that's a nightmare to administer, and it's not humane.
Yeah, no, I hear that. Okay, I just want, so,
And that's just my opinion.
so basically some other plan besides night by night.
This would continue what we do now.
Okay,
There's gonna be limits, because
Yeah.
the financial part will limit it, but,
okay,
what it's saying is that it doesn't need to be as complicated as it has been
that's it.
in the past. That literally is a nightmare to administer. Requires a lot of staffing, requires a lot of, angst by people who, are homeless, to be able to know whether or not they're gonna have a place, or whether they're gonna be, saying, yeah, you can have a place, but it's in Rutland, or you
Yeah.
can have a place, but it's in, Middlebury, or.
I'm not at all in favor. I just wanted to understand what.
Yeah, that's what the intent is.
Okay, 2209 is other emergency housing services. The department shall provide financial assistance to municipalities and areas of the state with a high volume of unsheltered homelessness. The use of this aid is at the discretion of the municipality and includes providing access to basic life-sustaining shelter when the National Weather Service declares cold weather advisory. Shelter provided pursuant to the subsection shall be time limited, shall not require coordinated entry assessment or case management, and shall have minimal data reporting requirements.
That's what we've talked about in terms of providing some assistance to municipalities. You can come on in. And there's some seats over here on the other side too, if you want. Yeah, you can't sit there, but you can squeeze in over there. All right, thank you. Welcome.
Section B, emergency cold weather shelters shall be managed through an agreement between the department and one or more community partners to provide overnight low barrier shelter when the weather conditions warrant. The department and community partners shall ensure equitable access to cold weather shelters for communities with a high number of households experiencing unsheltered homelessness. Shelters provided pursuant to the subsection shall be time limited, shall not require coordinated entry assessment or case management, and shall have minimal data reporting. How are these different? Hold on.
I'm just thinking. What happened to, and maybe this is something I deleted by mistake, or maybe I didn't. We had talked previously about, 10 degrees appears here someplace.
Yes.
It's the definition.
In the definition.
In definition, so it's already
It already applied.
It already applies.
Using the same term.
So
So which,
Yeah. You gotta check the emergency cold weather shelter definition.
Emergency cold weather shelter, yeah, is at or below 10 degrees.
Okay,
So we have to use the same phrase.
I think the national, yeah, the National Weather Service is cold weather advisory, I believe is colder.
No, the National Service declares a cold weather advisory. I think that's between like 20 to 29 degrees.
I was gonna say, that's what it used to,
Yeah.
used to be.
they are two different things. So yes, the emergency cold weather shelters have been operating at a temperature that their agreement says -10, that they have to open, but they have flexibility to open at 0 degrees. The municipalities, it's trying to replicate the availability of, like we had during this very, very cold snap that we had a couple of weeks ago. So the A is not intended to be B. So they are intended to be different. Colder weather under A. And B, cold, but not as cold. I don't think it's realistic for us to expect municipalities to do something that's not under extreme weather conditions. I'm just going by what our experience has been in the last couple of years, mostly this year, actually. They sort of snap into action when there's something that, well, we saw it happen. We saw, Rutland did it, Barry did it, Burlington did it. But it was only on those where the national weather had issued that advisory and everybody was preparing for it. So I just think it's unrealistic for us to expect that municipalities are going to do that on an ongoing basis. It would really only be time limited. Okay, I think we got to C.
I had a note there.
Okay,
How do you put a dollar figure on the municipality?
I'll be proposing a dollar figure.
You are,
I'm going
okay.
to. That we'll all
When
look
do
at,
we get the dollar figure?
when we come back from break.
Okay.
I mean, when we come back from town meeting break, not.
I knew what you meant.
Okay, I realized maybe not everybody did.
Okay, I knew.
Okay. Go ahead, Eric.
Just clarification purposes. What it's saying under A is the use of this aid is at the discretion of the municipality and includes providing access to basic life-sustaining shelter when the National Weather Service declares a cold weather advisory. The cold weather advisory in Vermont is, I'd have to look it up.
I
but
just
believe-
looked it up,
And it says what, between like,
-10 and -19.
That's
okay.
a cold weather advisory? Yeesh.
Okay.
I would agree with
Typically,
you.
and
That's-
that's geography dependent, so
It's
it can be even.
All right, no, I'm good now.
2
Okay.
degrees is.
cold weather advisories are those extreme
Yeah.
events.
Yeah.
Okay.
That's ones
Maybe
we
we
get on
can
our,
use the word extreme in there.
we get them on our phones if you've
Mhm.
signed up for the
Yeah.
alerts. that is what that's
So
intended for.
it's a definition.
Yes.
It's a
Yeah,
thing.
it's a
Yeah.
thing.
Yeah, I don't doubt it, but it's a striking thing.
Yes.
I know.
Yeah.
That
minus,
is-
what did you find?
And they don't get it
Negative.
unless it's expected to persist for at least 3 hours. It's less severe than an extreme cold warning, which is even worse,
So I didn't feel like
Versus
we should come up
advisory.
with our own
right?
for this. There's already things that it exists.
Right, just align it with.
Align it with what
happening.
exists. Yeah.
Yeah.
That's where I was going with, just getting clarity on the cold weather advisory, what that digit is.
Yeah. Yeah.
That's the AI summary.
My question on this section, let's see, would be about the rules set it's, I guess, within the department's guidelines about distribution, and I know we specified, you know, those areas with that high volume of unsheltered homelessness, but, would we have like a check back kind of situation when the department comes up with a set of rules about the very specific, when we actually have a dollar figure amount about how much is distributed where?
We can ask for, we haven't gotten to like reports
Yeah.
or reporting section or, but I am envisioning, something akin, although modified somewhat, to what they report on a monthly basis right now.
Okay.
So every month, we get a report and it's posted on their website where we can go and see how much is being spent. We can see how many households are being served. We can see the breakout of those households by district. And there's a bunch of other stuff there, but, so when we get to that place, we can decide what it is that we want to see in that, you know, with an updated system, we can decide what we want to see in that. Like, I think of that report.
Yeah.
And I think it actually is helpful to know, like, I don't remember if I just had this in conversation or if it was testimony, I can't remember now. But, you know, when the department was working with municipalities and they were working with community action and some of the shelter providers during, you know, our snap of really cold weather and trying to, and 211 and trying to make sure the information was getting out and, you know, they were issuing, you know, press releases. So that's, you know, we want them to continue to do
Yeah.
that.
Yeah, so just to clarify, because Doug looked up the National Weather Service
Mhm.
specific, which is geographically dependent, and it's actually for Vermont specifically, it's -20 to -29.
Yeah, I thought it was colder than,
-10.
-10.
Yeah, yeah, that's
Wow.
correct.
and that's why we have these other levels that precede that.
Mhm.
All right, let's keep going.
C, independent from this program, the Agency of Human Services through its various departments provides households with other time-limited or permanent housing. Such services include recovery housing, various residential supports for individuals with intellectual or developmental disabilities, home care services for older Vermonters and individuals with physical disabilities, transitional housing for individuals exiting correctional custody, and residential options for individuals with mental health challenges. Emergency housing provided through the program is not intended in lieu of access to any other AHS time-limited or permanent housing.
So that's a whole new paragraph. And once again, I'm trying to pick up on the nature of the department and the agency saying this is an all-in kind of approach. And so there really have been no previous reference to the services and supports that other agencies and other departments within the agency provide with regard to housing. And since this is being called a housing proposal, it seemed inappropriate to leave it out. But yes, yeah.
So I'm sorry, back to the B, emergency cold weather shelters through the community partners. That's intended to be different from the National Weather Service cold weather advisory.
Yes.
Right?
Yes.
It may need to be a little clearer because since it's all under one section, people might interpret that to mean the same.
I was thinking, what about adding like little headers, 1 or 2 words after each subsection designation to distinguish these 3. So for A, it would be something like municipal supports. I don't know. We have something better.
The other thing,
I'm worried that, you know, so a lot, the things under A are kind of under B. So let's say I'm just gonna, for example, we'll use Washington County. Like we know VIA has the contract and, you know, we heard from Beth Mayer, runs a shelter here in Montpelier, kind of under this B framework. And so I am just thinking about our other communities that aren't quite large enough to fall under this B to to have that ongoing, and don't have enough of a unsheltered population are definitely not going to get any funding under A. And when those communities with kind of higher populations have a resource already, if you see what I'm saying, is
Not
it?
yet.
It
It is true that smaller communities,
And I don't even mean tiny rural, I just
Yeah.
mean kind of some of the smaller ones, that aren't getting any kind of funding, that do have unsheltered populations, have no resources. And this is, it looks like A and B are kind of sending the same resources to the same communities.
So somehow ensuring that those communities that aren't currently accessing any
Yeah.
support or funding.
it is true that A and B is, I'm sorry.
That's okay.
No, keep going.
So having a way where there's like more equitable access to not only municipalities that know about this and have the infrastructure or
Yeah.
accessing the funds, where there's a way for smaller communities that aren't typically getting these kind of resources to actually opt in and.
Yeah, for those extreme, like when we had that cold snap, where it might make sense for, I'll just say, look, for Middlebury to stand up something, whereas they normally wouldn't, because they make do, and I know of other, all sorts of areas around, like, use like Esme, like Hartford or White, those kind of things where, yeah, it just.
And some will have just things they do. I mean, Northfield's another example of that. They don't have the money, they don't have the ability to actually stand up that kind of a shelter. But on the other hand, when it's that cold weather advisory degree -10, when we're hearing it on the radio, all that, it's just sort of announced around Northfield that the Norwich Gymnasium, will be available.
Our
with
Middlebury
cots.
Police Department lobby.
Yeah, right.
And so then they have to
Right.
get like
Cots.
volunteers,
Yep.
or maybe they don't even have those every time. So it's just ways we can fill gaps in communities that tend to not have as many of these higher populations, but could do a lot with just a little bit of resources.
So I do get what you're saying in terms of A and B are definitely aligned with the same communities essentially. And how do we recognize a more modest, you don't have to, go ahead.
Prioritize underserved areas, or, the department should think about underserved areas where, there
That
is
lack
not, that lack the
lack the
ability.
capacities don't exist or something like that.
What if we just took high volume out of there, or we afraid that opens a floodgate in A?
Well, I mean, to be honest, I do want high volume to be
Right.
prioritized, I guess I would say, but I think there may be some language, Dan, I kind of like that idea, some language that enables grants to also be made to communities where that are underserved by formal,
Absent services exist.
absences of formal supports or something like that. I think it's a good point that you bring up, Jubilee, that A and B are both targeted at the same communities, same regions. Yeah,
So might not have it, but.
no, but I can see how they
Few
like a
dollars, set something
Morrisville
up in a
or a
church or something.
Hartford or a,
And
yeah.
it can also, in these smaller communities, it can also be harder to actually capture the unsheltered people living within them. So it kind of exacerbates their ability to
Okay,
access.
Okay, think about how to do that. Thank you for bringing that up. Was somebody over here saying something that I missed? All right, we have, when are we doing 5:45?
No, I don't know, you didn't have it.
Okay.
I said 2:30.
Okay, I think we can get through this, because 5:45 is not gonna take too long.
He's only here till.
Oh, you're here to 3. Okay, so we're getting to the end of the new stuff.
So the creation but not content of a new section, that would be household eligibility and responsibilities. You have a section on case management services, and you had language when we did markup that a lead case management entity shall provide case management services to all eligible households. And then this new paragraph at the top of page 20, unless a member of an eligible household has a disability that prevents the eligible household's ability to participate in case management processes, or where case management is specifically exempted for specific services, and eligible households served by the program shall participate in case management processes, including cooperating with the department and with lead case management entity on screening and care planning. To the
That
extent,
needs work.
yeah, to the extent feasible and eligible.
And, you know, I guess I am thinking that the phrase that we've added in each of the areas,
Maybe it doesn't make this necessary anymore.
that might not
Right,
make that
this is
necessary.
repetitive.
It's repetitive now, I think.
And we have that new section where yet to be written that where anything that needs to be clarified can, the responsibility one,
Yeah.
this would really fit there. I was gonna say, this makes it like, if you have a disability, you're exempted from all
it's
requirements,
not.
even though it may be, it only impairs you from doing some parts, you know, so it would need a lot of work anyway, but.
So the phrase that we are generally using, and this appears in each section, is eligible households receiving, in this case, permanent supportive housing services shall participate in case management, planning for housing stability, and other services to the extent of the eligible household's ability. It's more positive when you say it, I think, than this.
Right, I think this is duplicates now and we should eliminate, and if there is something more specific that needs to be said, it would be in that new section.
I agree.
2212 needs assessment every fifth year beginning in 2028. The department shall contract with an organization to conduct a needs assessment that identifies gaps in services for homeless households in the state and includes recommendations to ensure the provision of equitable services throughout the state. And then we have an appeals section that was similar language in the last draft. An applicant or recipient of assistance pursuant to this chapter may file a request for a fair hearing with the Human Services Board. The board, if the board hears and makes identical determinations in X number of cases brought by applicants for the program or recipients, the department shall adopt the board's interpretation as part of its administration of the program.
So I think we need to probably reach out to the Human Services Board to see if that's a doable thing. I know that they recommended that in cases that were brought, and the department declined to do that. But I'm not sure it would be a certain, I'm trying to figure out, I'm not sure it'd be a certain number of cases. Do you know what I'm thinking? Because, you know, if there's 20 if there was 20 participants in a program, you wouldn't have the same number as if there was 2,000 participants in a program. And this will be a variable amount, so I'm just trying to.
But if it's identical determinations, that would put, you know, out 5.
Okay. So,
5 identical cases, that's
I'll
3.
ask, Human Services Board officer to weigh in on that.
The rulemaking hasn't changed, but last time we went through it, there's sort of the impression that that alone could stand by itself. And I think when you're designating or delegating authority, you might want to have more parameters and specifications as to what you would like to see addressed in the rules. So I flag that for you.
Okay.
Reporting, we still don't have what will be reported on, but addressing each of the services in the continuum instead of continuum of care with regard to the following. So placeholder for now, but I'll strike of care. There's language that you've already seen regarding a merger of the continuums of care. Now we have intent language. In order to promote the effective use of resources and continuity of care, it is the intent of the General Assembly that DCF's OEO shall work in collaboration with the continuum of cares and HUD to establish a single continuum on or before October 1st.
So this morning, when we were having testimony about another topic. Legislative intent doesn't say that that actually has to happen.
That's aspirational.
Right. I'm not sure it's aspirational. I mean, I feel like so I think that maybe needs to be steps. So I think we would need to get a progress report. And I'm not sure what's a realistic progress report time frame. So if this went July 1, and then there's I'd probably say January of 20, this is
29.
28.
Is that
January,
different than the
January
status report
28th.
that's later?
no. Yes, I think it is different.
From OEO,
Yeah. So,
remove the intent language and then instead have this language stand alone, and we'll put a subsection B in that requires a progress report by January 15th from OEO.
2028. Because 2027 would be too
They
soon.
have, yeah, I get it.
Yeah, so you have time.
Okay, but yes to removing the intent language?
Yes.
Okay. Okay,
But then if that's then the completion of it is later than October 1, 2028, if the interim report is.
Not
Well,
necessarily.
January, that gives them 10 months.
Oh, okay, I got it, yeah.
Yes.
Desire is to see them moving towards that. This is not a feasibility study as to whether they.
It's not,
Right, it's a status
Exactly.
report.
It's-
Tell us how
How's it coming?
far. Yeah.
right, unless we hear back that, HUD says we cannot do that.
Yeah.
If that's the case, then we have to live with it, all right? But if we don't hear back that that's the case, we would like to promote this and to achieve it. It was very telling, I thought, I'm sorry, I feel like it was very telling that, the differences in the timeframes between when coordinated entry assessments were completed between balance of state and Chittenden County.
It's different.
It was very different. And it made me think, why don't the balance of state people help out the Chittenden County people? I don't know. That's probably too uncomplicated of an answer. That's more complicated, but, okay, Katie, I just want to make sure we have time to do before you have to leave, that we have time to do 5:45. So I think that this is a good place to stop. Okay. Okay, 5:45.
Oh, that's legislative council action.
No. Yeah, that's fine. Hello, welcome. Yeah, sorry, it's standing room only right now. Where are y'all from?
Milton.
Milton? Oh, great. So you have a representative here.
Oh.
Nice to see you, Andrew.
Okay, we're just pulling up we're pulling up, okay, we're on live, Brenda. Thank you. Please, close the door, whoever is coming and going. Okay, thank you. Katie, the floor is yours. We've moved to H 545, which is our immunization bill. And what we are doing right now is reviewing the changes that were voted on in the Senate. It's been through second and third reading in the Senate. It should be on notice probably tomorrow. So Katie will review their changes, and we will have a vote as to whether we concur. And then Don will report on this whenever it appears on the calendar. Okay? Go for it.
Thank you. So only I have the document, so I apologize.
That's okay.
It hasn't been a,
Lori's actually posted the Senate Health and Welfare.
it's perfect. It's the same.
That'll work.
It's the same thing.
It's coming in.
It's coming.
Okay.
But we have to go out and go back in, right?
Yeah, you gotta refresh
Once.
It may not even.
Oh, wait, it's not quite yet.
No.
So there are 3 changes that the Senate made to H 545. The changes were requested by OPR. Sorry, I had to collect my thought. My brain is.
Yeah, I know. It's switching gears, I know.
Moving over to this one. So the first change was in section 3. There we go. The Vermont Immunization Advisory Council, if you'll remember, this is an existing council in state law. There were changes made to the membership. The originally OPR had asked for the executive director of the pharmacy board and the executive director of the nursing board to be added to this group. The House did add those 2 positions to this advisory council, but afterwards, OPR said that they felt like the interest of having a practicing pharmacist and the practicing APRN were sufficient, and that those individuals probably had more expertise to be able to advise than the executive officer would of the 2 boards. So those 2 positions they requested to have removed. So that's the first change. The second change is in section 7, which is the pharmacy tech section. Here we go. So OPR asks that this section be written. It is reorganized, and some of the underlining is moving existing law to different, just reorganizing it in a different order. What's new is this language in 2, which is the authority for pharmacy techs, and I will read through it. Previous version that the House had passed out more specifically referenced CDC, if I'm remembering correctly. Am I remembering correctly? Yep, it did. And so this version does not. OPR likes this language and does not want it to sunset on the 2031 date. So the third change is that where this committee, the House, had reverted back to the existing language, there will just be the words deleted in that section, meaning the section itself is deleted and this language would stay on after 2031. So this language reads that the pharmacy technician shall only administer immunizations when a licensed pharmacist who is trained to immunize is present and able to assist with the immunization as needed, pursuant to a valid prescription by a practitioner, a standing order made by the Commissioner of Health, or a protocol approved by the Commissioner of Health under the previous section 2023, which is the pharmacy section that you amend in your bill. 2 patients who are 18 years of age or older and 5 years of age or older seeking influenza immunization, COVID-19 immunization, and subsequent formulations or combinations thereof. So here you'll sort of see this strike through language, and that has been moved up higher in this version, this 22, this reference to 2023 has been moved up here. Still striking through the language about CDC guidance. This language in 4 has been moved up to the top of this paragraph. So that isn't a true strike through, that's a move. And again, the strike through as part of your bill, striking out the reference to the CDC. So that is the change from the Senate, I'm sorry.
So, I'm just trying to think of the practicality of the pursuing to, but that number 2 is, I'm trying to think about how like, if I go to a pharmacy
Mhm,
right now, I don't have any prescription
mhm.
to get an immunization.
But there might be a standing order from the commissioner that already exists that would allow you.
Or there might not be.
Or there might not.
I mean, you see signs all over the place, get your free flu
Shingles.
vaccine, get your shingles. It's,
Yeah,
so this is what's bothering me a little bit about this. I'm not. Can you bring us to the protocol part?
So this is up above in this section. So this is the pharmacy section, the pharmacist section. State protocol, a pharmacist may prescribe, order, or administer in a manner consistent with valid state protocols that are approved by the Commissioner of Health after consultation with the Director of Professional Regulation and the board, and the ability for public comment. And it lists what could be administered. And included in that is recommended immunizations.
It's defined, okay.
And then this does revert back. So after 6 years, this would again reference CDC instead of recommended immunizations.
Okay, so that's what the current process is now. So I guess should we presume that all these pharmacies advertising, access to these immunizations are operating under
Protocol?
these protocols?
I would say yes, but if you would like to hear from OPR, they're going to be the experts. on
Yeah.
Yeah.
Does anybody else have a question about it? If it's only me, then we don't need to.
No, I'm only just like wondering what the rationale was behind the reason for change.
Yeah,
But I don't think we could answer that.
I'm pretty comfortable with
Can-
it. This was what
well-
OPR recommended that.
We just need to know, that's what struck me.
I could see, let me see if they kind of articulate their position in their documents.
so to Senate Health and Welfare.
Yeah. I'm not seeing anything posted.
I'm just wondering if we might be able to what's her name?
Jennifer or Lauren. They
Yeah, either one of them, probably Jennifer, yeah.
can also check my inbox and see if I have any email that is more descriptive.
I don't think it's an issue. I just am like, it seems like it's limiting under what conditions, and then I'm just wondering, well, how is this stuff that's all out there now? Is that going to be, is that, because that's new language, is that going to limit what people are currently doing? Is it going to somehow change what people are currently doing? That's really the only question that I need to ask, unless other people have other questions. Lori, could you check in with Jennifer, what's her last name?
Colin, COLIN.
At OPR, see if she might be able to join us via Zoom to just answer one question on 5:45.
Hey.
The timeline that we need to make a final decision about this is
It'll be before tomorrow.
before tomorrow.
Okay.
So I figured, and we got plenty of other things that we need to do.
Yeah.
So I figure like if we can get it all wrapped up, we don't need to be downstairs till 3:30.
Yeah.
If she's not available, she's not available.
Got an email from her.
Okay,
Language.
let's see what the email says, Lori.
We realize that the language about immunizations that pharmacy technicians are permitted to administer required further revision. Pharmacy technicians could administer immunizations that are pursuant to prescription written by a practitioner, state protocol, standing order. The current language does not include any scenario other than a state protocol. The current language in 2042A-C does not include any scenario other than a state protocol. And in pharmacies, pharmacy technicians are and have been administering vaccines that are ordered through either a prescription or a standing order issued by the Commissioner of Health. So we are proposing the revisions below to align the statutory language with what is happening in practice.
Okay. All right, so essentially what they're saying is that they must issue, the health department must be issuing protocols.
Mhm.
That must be how, you know, we see all these access to these various immunizations out there on these boards.
Yeah, I don't know how they issue those standing orders.
Okay.
I would have been surprised.
So it's not up to us to, we don't have enforcement opportunities here. And if what I understand from that email is that they're trying to make that consistent with what current
What's
practice
actually
is,
happening.
what's actually
Yeah.
happening. So
Um,
that was the answer that I needed. Yeah. All right. Was that it for changes, Katie?
Do you, I mean, I can show you where it says deleted, if that is something else.
Don, are you clear?
Yeah, oh, well, I think so, yeah. I think so. I have to do some thinking. I mean, a question or two will pop up.
Okay.
Yeah, I think,
All right.
I think I'm
So-
good.
On the floor, when this comes up on the floor, then, you know, we review and, you know, just an overview of the changes and then we would give the committee vote on it. So, okay, so I think these are just, are these straw polls to concur? We haven't done a change from this. I think it's just straw polls.
First.
Yeah. Yeah.
To concur.
Yeah, so, Todd, I don't know if you're there or not, but, do you want to participate in the straw poll?
Means using, oh, no, it's straw. Doesn't
Yeah,
use it,
you don't.
Yeah.
doesn't use anything. Okay, that's just his name and not him. Okay, all right, so, how many people are, by straw poll voting to concur with the Senate as passed by the Senate? Okay, so that's 902. 902.
02.
Okay, thank you so much, Katie, for spending so much of today with us. Pleasure. Thank you. We enjoyed it very much. And thank you for all of your hard work. Okay, folks, so let's take the next 15 minutes or so. Just to have some discussion about what we just saw in the latest version of the homelessness bill. So just free for all. It's a free for all.
We don't have enough money to do the things that are really going to solve. Yeah, I just think it's unfortunate. We have to remain within the governor's area, but it is what it is. And so what I'm kind of, how I am approaching it and thinking about it is, despite that, how do we set up systems that will hopefully, when we're in a better timeline, I don't know, when all of the various things affecting what we are able to do might be different. Perhaps we will see more federal support for homelessness in future years. So, yeah, I mean, every part, I'm just like, this is insufficient money, insufficient money, insufficient money. So I am, yeah, I mean, that's not a reflection on the bill, but of how, when I'm reading it, I'm trying to approach it is how are we setting up good systems when we know we have insufficient funds to truly make progress in any of these areas.
I would add to that, I said, especially with the lack of housing assistance at the federal level right
Yeah.
now. It's gonna make, I mean, you will see, it won't be a surprise to anyone because it was in the governor's proposal and we did hear State Housing Authority, there will be a section that creates a, state funded,
Yeah.
housing voucher rental assistance,
Yeah.
section, that, I am gonna propose the State Housing Authority run it though, not that it be done at DCF, because I think it needs to be broader than just DCF.
And I agree with that approach.
So, yeah, I mean, I think if we had, all the money in the world, we would, there'd be, we'd be the ones taking charge of trying to make sure that there's enough housing, that people can afford. Other thoughts? Yeah, go ahead.
I'm just trying to figure out how we are going to work through what I anticipate to be a sticking point with the administration with respect to the winter emergency housing. And I agree with our position or the position expressed in the bill at this point in time. And they've lived through the night by night determination and nightmare of managing that. So where's the middle ground? I don't know if the middle ground for them is to set a specific number of rooms that can be utilized in this way, but make it available for this December 1st to March 31st. Just expressing a concern or a question as to where the sticking point is and how we're going to find our path forward, but hopefully.
It's the one that, I'll be honest, when I signed on to 594, it's the one identified right away, that was the night by night thing was just, it's a non-starter. There would be insufficient votes in the full House to pass a bill that has that in it. And so if they're hard and fast on that, then we would be at an impasse. And, to be honest, the budget won't contain language about night by night either. So it will be an impasse here and it would be an impasse in the budget if we don't pass a bill. There isn't any way that the House will pass something that says night by night.
And I hope administration will recognize the many elements of H 594 that appear here, that we can find a middle ground, and they can let us know where we need to be on it, other than, night to night, which I would agree, that's a non-starter from my perspective.
I don't know if I could say this, well, it is a concern. To get to a destination, we need a bridge. And this bill is, or even the other one, it's conceptually sound. Problem is the timing, the capacity assumptions, and the implementation of this do not reflect really the reality on the ground.
Yeah.
We haven't worked on those yet.
I understand but both of these things are designed as long-term reforms. And it's just not, the long-term reform is just not practical at this time. We need a bridge to get to those long-term reforms. I don't know if I'm sounding correct, but again, we have this destination. Yes, conceptually, I said the same thing in regards to the introduction of 594. There was a bridge, H91 is the destination. That was the destination. Both of these committee bills are destinations. We got to bridge it to the destination. Mm-hmm. So conceptually speaking, it is feasibly going to be very, very difficult to implement even the structure and the intent of the continuum care program without building some type of bridges to get to that destination. That's my concern, is we may be placing providers in a rather precarious position, which then in turn puts harm on those that we're serving. I know that's not the intent by any means. I'm just pointing out that we gotta get some language in here that builds
Yep.
a bridge to where we can feasibly operate it, manage it, and we're gonna receive good outcomes. At this time, it'd be nearly impossible to implement and operate these strategies. And that's got nothing to do with ideology. That's got nothing to do with funding. That's got to do with what is practical
Yeah.
and can be applied.
Yeah,
Can I ask a question of you, Eric?
Sure.
Wouldn't
No,
that,
absolutely not.
wouldn't the same statement be true regarding H 594?
yeah, I don't see how 594 is a bridge. That's what, I know it says right in the beginning, 27 and
Temporary.
28.
No, because there was the temporary, it most certainly
Well, no,
was.
explain it, because I didn't,
Because it was temporarily defined. It temporarily drew down on this, helped build up capacity and infrastructure with providers, gradually just implemented other strategies. And I can go through it all in my head. But it was truly, as I introduced it, was truly a bridge because of the temporary elements to it that help build infrastructure and workforce capacity.
Wasn't there, I guess I'm not sure I saw it as clearly, but to the extent that there was something in there, I'm not sure it was a sufficient bridge because it ratcheted down very quickly the number of available hotel rooms in this upcoming fiscal year, to me, which seemed unrealistic for the reasons you just said, that the capacity we need to build out for the balance of the efforts, whether it's 594's efforts or this committee bill, is going to take time. And the ratcheting down was a pretty steep hill in 594 with the number of rooms that were recommended.
And to that point too, this is where the highly amendable came in. There were 14 clear access points within that bill that were completely able to be amended, i.e. time limits, i.e. hotel capacity drawdown, i.e. eligibility verification, and other points that literally were designed as short-term access points of amendable. You couldn't look at it and say, well, that was set in stone. No, that was one of those amendable points that could have been looked at.
I guess I see the bridge in the committee bill version we looked at today as being the final level. Now, we may want to set up, because we have all these other steps before, level 1, 2, 3, 4, before we get to 5 and the use of motels. We may want to assign dates by which we hope those levels will be serviceable, if you will, for this continuum. But to me, the bridge is to still have the availability of level 5 until we get levels 1 through 4 built. Does that seem to reflect the intent?
It's more of a bridge being in regards to the entire
The structure,
system and
yeah.
reform of the entire. This bill is kind of it's reforming the entire system
Who's
as
doing
is.
what and all that?
I'm not really sure it's
Yeah.
doing as much of that as people perceive, to be honest, because so the intent would be, one, to put more money out there in case management, so, and,
Which we all agree.
which I think everybody agrees
And that's
about.
not money.
Here's where I can say, like, here's the intent. Within here, there's an expectation that everybody has a case manager.
Yes,
So we're talking, as the numbers we're showing on here, we're talking about possibly 4,000.
we're not
But we
though.
talked about
'Cause this
that
is
we
gonna
don't
be-
have the resources to.
No, I'm not saying, but in there is an expectation that everybody has a case manager.
Yes,
You can't, that's feasibly impossible to fund enough case managers where bridges are, like, okay, let's gradually invest here and invest there.
yeah, I don't think we're saying different things.
I-
And I'm going back to what you said earlier, where you're conflicted.
Right, we
Because-
haven't defined the buckets of money yet.
This is going to mean that fewer people receive services in order to provide the comprehensive nature of services that we would expect.
Not only services.
So it's not
but-
4,000,
Shelter,
it's
that's
fewer.
what I mean.
Yeah,
I'm
yeah,
not even
yeah.
speaking.
This version that you placed on out is lot better than the previous one. The previous one, over time, would have completely there was no way to run that. That would have completely destabilized the system as a whole.
Yeah.
So there are
That's
mechanisms
fine.
getting back in here
Yeah,
that,
and I think it is important for all of us to recognize that we don't necessarily have the workforce to accomplish what we see the desired state as right now. So, how do we get there? You know, and so, I'll be honest, I'm not particularly enamored with putting 21 staff at DCF I didn't really understand all of what they were going to do, but I think those resources are better placed by investing in case management in the community.
great.
OEO will need some additional staff because they have more responsibilities
Some
here.
more grants.
So, right, so they will need some additional staff. But the bulk of that I want to see go out into the community. So I think that, I think we have to be realistic about if we're going to, what I hear over and over and over again from the administration is that, the need for supportive services and case management for people, I think they use the term warehouse or something like that, in hotels. And I guess I want to say you can't have it both ways. You can't say we need to invest and then say we're not going to invest. So I envision this as investing in a system, getting back to what Jubilee said earlier, in a system that hopefully we won't be in the place where we are right now, where we have so many people, who are going through very hard times. And so I think that there's a place for both, I guess. Figuring out how to transition to a system that we would like to see, and how do you transition to that? And that's through making essentially appropriation decisions each year about where you're going to put the money. And so, we'll have lots of discussion within the parameters that, of the governor's budget about how much gets invested in case management, how much gets invested in prevention and diversion versus, level 5 of hotels or, other municipal supports or, any of those things.
And that actually helps shape
Right,
what
the
that
numbers.
transition
Looks
looks like.
Exactly.
Yeah.
That's
That's
what's
what-
gonna
that's
put
how I
the
envision it.
guardrails around.
Yeah.
Like when we make those decisions in the next few working days we have, for me, that's gonna create the guardrails and the lines of how much we will do. So to your point of like, there's just no limit, I think the money, the resources will create the limits, because we're saying right now, we have this X amount of dollars that the governor is recommending in his budget, and we're committing to not going over that. We're just going to make decisions on how to spend that differently. And I think, personally, I'm going to look for ways we can invest that money, more of it towards those prevention services and supportive services, because we know those have better outcomes. So that will mean, back to my earlier point, that we'll have less resources to devote to that, the least supportive service where it's just literally a hotel room or with no other things around it. So for me, those decisions will create the kind of guardrails that you're looking for, I think. And I feel like we're not there yet, but we're gonna get there. So I hear what you're saying, but
As I said, completely agree with the conceptual concept of the whole thing. the concern that I have is we may be building Rome in a day where to step back and make sure we have the appropriate, if we want to call them guardrails or mechanisms in place that the city doesn't crumble before we get the right mechanisms there. Another concern that I have is the hotel. We got to take into consideration that once you put on-site supports at a hotel, and I'm going to use Rutland City as an example, that's a completely different permitting. They're changing the way that they operate. So we could run into situations to where we may be displacing people from hotels because the charters and the permitting won't allow that change of operation. You are literally going from a hotel to we're shelter. And so logistically speaking, yeah, well, logistically speaking, you run into it, several structural and logistical things that we certainly don't want to see take place. That's why bridging is always before you get the things here. But yeah.
Yeah, no, I get what you're talking about, Eric. I do get what you're talking about. And this envisions a strong community-based system. And I think that everybody would say that community-based system needs investment in order to become even stronger than, what we have today. And, I think we do have to be careful about unintended consequences. And I feel like I need to hear a little bit more about how that bridge functions worked, because, as I was going through this and comparing what I was putting in here, I was feeling like I was aligning a lot more with 594 in terms of this kind of tier approach that was proposed. And I other than what Doug said, the severe ratchet down of the use of hotels, I didn't understand, other than the first few words that said in FY 27 and 28, I didn't really understand how the bill worked as a bridge.
It was never designed as a full reform, is what I'm getting at. H 594 was never designed as a full reform of the system.
Yeah.
I'll tell you, if I end up supporting this, I will not have seen it as a full reform, because to me, there's no full reform until we have a roof over the head of anybody who's on the street, every person. And this doesn't remotely get there. So is it a full reform? Absolutely not.
Well, that's where I think there's,
It's not a full reform.
but I think that's another difficult discussion, because believe me, I'm all for it too. But practically
You
speaking,
can't get there right
we are
now.
not going to be the first in the country to end homelessness. So if that's our goal and objective through a bill, that's.
No, but that's what I'm saying. It's not, it can't be, all the way. It's all part of ultimately maybe making change down the line. We do say still in the most aspirational,
Brief, non-recurring.
brief and non-recurring.
Yeah.
Yeah.
But that's purely aspirational. We know this isn't going to get us there.
And I think one of the things that I am encouraging all of us to keep in mind is there is nothing in statute right now. Nothing. And one of the things that I think that we owe to Vermonters is to be clear from a legislative perspective about what is the policy that we're expecting from state government. And especially because we're spending tens of millions of dollars every year on this. And it is, right now, there is nothing that governs that, you know, other than what the department decides. And that's the purpose of the legislature, is to set a policy direction and to assign resources to that. And absent having anything, that's been done through the budget, which is a really inappropriate place for that to occur every year. I think everybody agrees with that. So if you can keep in mind that we're not placing something, it's in there already because there isn't anything. We have a responsibility as a body to set policy going forward. You have something you want to say?
I just want to suggest that, or say that I think that what I like about this approach I see today is that it's very visionary. And if we had twice as much money as we had, we probably would be having a different kind of conversation about that very vision. The fact is, I think that what is causing attention is there's not enough money to do what we'd like to be able to do. And so we're anticipating a pretty rough moment here coming about making decisions that are going to be not ideal, no matter what we do. And we feel that restraint. And I think it makes it difficult to look at a plan that might be visionary and see it for what it might be, and might be able to expand and grow some still even on down the road a ways. But I think it's really great that there's this arc out there for us to see. That's where we're headed, and we do the best we can to get where we can.
And recognize that it has limitations.
Yeah, that's what I think we can move forward still. Great.
I also think, Eric, to your point of like system reform, I would not look at this so much as system reform. I look at it as creating infrastructures to set us up for success in the future. I think, to Teresa's point, like, we are putting something in statute that does not exist.
Yeah, it's not
So-
system reform, there's no system.
There's no
system.
Trying to
So we're
create.
establishing.
And that's what's really scary.
Mhm.
Yeah.
No, think about that for a minute. Here, I don't know how long Vermont's been around, hundreds of years, like, but we have no
250.
system in place to address, and we knew about this crisis 10, 12 years ago. So to say system reform, yeah, wrong term.
Yeah.
You can't reform something that never existed.
That's right.
So we're establishing an infrastructure that will, and for me, like we just said the word progress, like for me, like we got to start somewhere with the limited resources we have, in hope with the aspiration that will get us closer to that, aspirational phrase we have on the first page of the bill. Because, and we've done this before, we reformed childcare 3 years ago. We've done reform, and we have had, out of this room, we've had really good policy that changed massive systems and state government, and they've been implemented beautifully, working with community organizations, municipalities. So I feel like I don't want us to be afraid that this is too big of a change and not, that then will prohibit us from doing anything, because I think we need to do something because nothing exists right now. And with us committing to not overextending ourselves with the resources we have, I think we're making a commitment to Vermonters to say, we're taking the resources that we have, we're not asking for more, and we're creating an infrastructure to help us do this in the future in a much more efficient, productive way with better outcomes. And I think that's what we're getting towards. We're still drafting, but that's what we're getting towards.
All right, on that,
Sorry.
I'm gonna know.
Last word.
No, that's no.
Have discourse.
Yeah.
So
It's good
quality in it.
conversations, yeah. No, I wanted to end on that positive note, so, okay.
Two hard things.
And what?
Oh, it's not that.
No. Okay, so, Lori, we're all